Long Neck Sports Grill is the place to be this football season with 3 very easy-to-get-to locations in Northern Kentucky, 4K TVs all over the place, and the sound always on for the big games. Long Neck's menu has something for everybody, but you've got to try the wings. And no place has a better beer selection than Long Neck's. Each location is very easy to get to, Wilder, Hebron, and Richwood. And don't forget, Long Neck Sports Grill is the home of the Roundtable Show. This football season, you've got to get to Long Neck's. Stay late. Come often. If you need, if you have a need for orthopedic care, if you've got a sports medicine issue, the folks at OrthoCincy can help. We normally talk with one of the experts from OrthoCincy on Wednesdays because of some scheduling issues. We are doing it today. The great thing about OrthoCincy, I say this every single week, they have specialists and locations everywhere, all across the tri-state, and they've got walk-in orthopedic urgent care at 5 tri-state locations. And that includes extended evening and weekend hours in Edgewood and Anderson. Learn more at OrthoCincy.com. That's OrthoCincy.com. Dr. Amelia Wiggins is with us. Let's talk about Chidobe Awuzie. Now, the good news is it looks like he is getting closer to coming back, and we'll see if he plays on Sunday. He did not play against Arizona with a tweaked back. That's what they said. He had a tweaked back, suffered it in practice, reportedly, on Thursday. So let's start with that. A tweaked back, that is not the most, I guess, scientifically, medically approved verbiage. Nonetheless, it's a tweaked back. So what is the range of possibilities we're talking about here?
Yeah, when I hear tweaked back, my mind goes immediately to soft tissue. You know, he pulled a muscle, he strained a muscle. I wouldn't think that's anything too serious. And I think he's just, you avoid making that worse. So if he can sit out a game or for a week or two, then hopefully we can then bypass some long-term problems.
Are there things that a minor tweak in a back might signal? Could this be a symptom of a bigger problem?
It could. You know, it depends on where he's tender. Again, it seems more muscular, but if he is tender along the spine, you know, and you continue to play through some low back discomfort that's on the bone, then that can progress into stress fractures and herniated discs and things like that. But with a tweaked back, that word to me means more muscular injury, which just needs a little rest, a little stretching, some physical therapy. Back out.
All right. Hopefully he's back on the field soon. I don't think this is going to be the case for a Matt Milano of the Buffalo Bills. And so there's something interesting about this to me. So they go to London and play, and he comes away with a leg fracture and a possible ACL injury. So there's 2 different injuries here to the same leg. How does this possible double injury complicate the treatment options moving forward?
Well, it certainly does. And I tried to look up, you know, what exactly the fracture is. People were suspecting a fibula fracture. Usually those, you know, you do surgery, you're back 6, 8, 12 weeks. But to put a soft tissue, an ACL injury with a fracture, that makes me think more it might be a tibial plateau fracture, a fracture through his joint line. That is much more severe because then you're healing along the joint, which is a horrific injury in itself, and then to add a soft tissue component such as an ACL, we already know an ACL takes 9 months to a year to get back. So if he does have a fracture through the joint, which would be a tibial plateau fracture plus an ACL injury, then that could be a 12 to 15 months recovery for all of that to heal.
Yeah.
So I think as we know more where the fracture is, we can look more for his recovery, but it doesn't sound like a good injury.
Athletes suffer injuries all the time, and then they have to travel the day they suffered the injury and often fly from coast to coast. The Bills were in London. Now, obviously, Buffalo's in the eastern part of the U.S., so it's a shorter flight than if they were going to Seattle or someplace like that. But still, it's a lengthy amount of time on an airplane, even if they're not, you know, squeezed into the middle seat in coach like I would be, right? Still, it's a long time to be in an airplane. When you're dealing with an injury like this, does that length of travel complicate things at all?
It does. If you think about any time you've been on an airplane, what happens when you get off? You're automatically more swollen, you're stiff, you're uncomfortable. And with a fracture and an ACL injury, we need that swelling and the inflammation to go down before we can safely do surgery. So getting back, on the plane and coming home right away, that might set back his initial treatment. If he does need surgery, it might set that back a few weeks. But again, looking at a 12 to 15-month recovery potentially. A few weeks on the front end isn't going to make that big of a difference on the back end, but I'm sure that was an uncomfortable flight for him.
No question. Dr. Amelia Wiggins from OrthoCincy is with us. Let's talk about Deshaun Watson, who did not practice yesterday. He is dealing with a rotator cuff contusion. Now, he was medically cleared to play last week, but he still sat their last game. He sat against Baltimore. And so there are questions lingering about the severity of the treatment and why he would be cleared if he still can't go. We hear all the time about rotator cuff tears, but what is a rotator cuff contusion?
Rotator cuff contusion, very common in football, especially when you get hit as the quarterbacks do. It is a bad bruise, basically. It's a horrible bruise of the rotator cuff. So it's not fully torn, but that rotator cuff is stunned. It has a lot of pain, inflammation to it, which causes weakness. And of course, in your quarterback, you need a strong rotator cuff so you can throw the ball with accuracy and velocity. So for him, we'll see. I wonder if it was more of a strategy play for him sitting out. You know, they played against Baltimore. Baltimore, of course, was, I think, 5-0 at that point, or 4-0. And then they have a bye week right after. So his sitting out that week could have been more strategy, where we're going to just give this a couple more weeks to heal because we can. We're not expecting to win this game against Baltimore, and then get back, you know, later in the season when they still have a chance at the playoffs.
So you're saying, like, the medical people could say he's good to go, but the football people might say, you know, we don't need him this week. We're good to go. Let's make sure he's healthy moving forward.
Yeah, I think that would be a strong possibility here with that with that specific diagnosis. But of course, you do want to protect your quarterback, right?
Sure.
You know, about 10% of these contusions can turn into tears, and then that could be career ending or at least a year off. So it's just, if you have a game that might not be worth it, then it's probably not worth it.
All right, one more. TJ Watt of the Pittsburgh Steelers. So he suffers a finger dislocation and some torn ligaments in their game against Baltimore, and he popped it back in and kept playing. Pittsburgh doesn't have a game this week, and so he has some time to rest. Now, we love, hearing these stories of football players popping in dislocated fingers. It's a testament to his toughness. But is doing something like that actually wise?
It's okay. Yeah, it's okay. If you dislocate your finger and you can see that it's crooked, please straighten it. It will. It will feel better. The sooner you get that joint realigned, you will feel better. Even my 7-year-old kid actually this summer was going down a water slide and dislocated his finger and immediately put it back in, and then came home and said, "Mom, I dislocated my finger and I reduced it." I said, "I am so proud of you." Because if he waits that 5 or 10 minutes to go see the medical staff on the sideline, or if my kid is waiting to see me, then that's when the adrenaline slows down and you start to become guarded. And then you can have a little bit more damage if you're guarding while that person is trying to relocate your joint. So if you see a finger's crooked, straighten it.
All right. Is there risk? Like, what if it goes wrong? What happens? Like, I think I would want to pop it back in, but then me being me, I'd worry about, like, all right, what if I screw it up?
You won't. It'll go back in. I promise. It's going to go back in, and if it doesn't, don't try again. Then go to the doctor, the medical professional on the sideline, and let them try. We kind of have a rule of 3. You give it 3 tries on the sideline. If it doesn't go back in, then there's a bone in the way, there's a ligament in the way, there's a reason why it's not going. Then we get the X-ray and reduce it, in a controlled medical environment with some sedation or whatnot. So give it a go. If it doesn't work, go see somebody.
All right, I'll keep that. I don't know why I would suffer a finger dislocation, but if I do, I'll pop it back in.
Awesome. Put it back in, and then come and see us.
That's right. Very good. All right, Dr. Amelia Wiggins from OrthoCincy. Always awesome to have you with us. Thank you so much.
Thank you. We'll talk soon.
You got it. Looking forward to it. Dr. Amelia Wiggins from OrthoCincy. I say this every single week because I mean it. The great thing about OrthoCincy is they have specialists and locations all over the tri-state. That includes walk-in orthopedic urgent care during the week from 9 a.m. to 9 p.m. and on Saturdays from 9 a.m. to 1 p.m. in both Edgewood and Anderson. It's easier because you don't need an appointment, and it's definitely cheaper than going to an ER whenever you have an urgent orthopedic injury. Learn more at OrthoCincy.com. That's OrthoCincy.com. Looking for a place to watch all the games with your buddies this football season? You've got to stop by Long Neck Sports Grill. There are 3 locations, each one of them with 4K TVs all over the place, and the sound is always on for the big games. And you've heard me talk about Long Neck's menu, but have you tried the wings? What are you waiting for? And no place has a better beer selection than Long Neck's. And don't forget, Long Neck Sports Grill is also home of the Roundtable Show. Wilder, Hebron, and Richwood, each one of them awesome. Long Neck Sports Grill. This football season, stay late. Come often.